Good evening, ladies and gentlemen, people who are here in person and people who are present virtually. I'm Dr. Mehreen Suleiman, co-director of CCIT, and my colleague, who I'll be introducing shortly, and I will be your hosts for the evening. On behalf of Team CCIT, I welcome you all to the book launch of AKU's first ever digital book, MEDJACK, The Extraordinary Journey of an Ordinary Hack. You know, innovation, they say, is doing things a little better. And the things that connect are simple things. So this is our work, our journey of making ideas happen, a journey of innovation and beyond. So let's celebrate the compilation of CCIT's journey, our story, and our drive to break the status quo. I'd like you people to welcome Dr. Karl Amrhein, Provost and Vice President, Academic, to virtually and officially kickstart the event. So over to you, Dr. Karl.
Good day, everybody. Assalamu alaikum. Hello from Edmonton, Alberta, where we have just received 3 centimeters of snow this morning on May 18. So very different worlds this year, it would appear. It's a great pleasure for me to be here. It's a great pleasure for me to be involved in the launch of this book. CCIT has been an important part of the evolution of the academic infrastructure, the academic reality that is AKU now and into the future. And if I look at the screen of wonderful young academic colleagues that I saw displayed just a few minutes ago, it might also be the case that innovation that is represented by CCIT, creativity and entrepreneurship, is something that a very much younger generation of academic colleagues is bringing, not just to AKU, but around the world. It's been my pleasure to be involved with the spirit and the soul of CCIT, Dr. Asad Mian, for the 5 years that I have been part of AKU. From my point of view, the investment that the university has made in CCIT has been richly rewarded many times over, and it has helped AKU begin to build a reputation as one of the leading institutions of our type in Pakistan and beyond. The appearance of the book MEDJACK is an exciting next step in the evolution of the work of CCIT. And I have with me, in the best traditions of the Academy, some quotes from 4 external referees to whom I sent the book for their review. And these are 4 very diverse external referees. And lest I keep you all on the edge of your seats, every one of them had strong positive things to say about the book, and I'll just read a couple of these. The first of the external referees is a very senior retired professor from an internationally acclaimed medical school. He took his discoveries at the bench, he built a company, and then he took the company through its positioning to become a public corporation. And he spent the last 20 years advising people such as yourself on how to take ideas launched in an academic environment through their startup phases and into the market. His view is the book focuses on innovation in the developing world. If it stays focused on that, it can develop a niche. This is something that is novel and should be emphasized. The unique feature of the book relates to Jugaad. As an academic, he is the most brief of the referees. The second person has played a critical role in launching several public corporation artificial intelligence products. This is a person who has spent their career creating the algorithms that are now viewed as artificial intelligence. And this person says, within each chapter, good context is provided on what is the methodology, how it works, history and background use of CCIT. The book is all about real-life examples, not theories or ivory tower research. And for each concept, an implemented use case is referenced. The third referee is a person who has built several companies, sold them, and in some cases bought them back, rebuilt them, and resold them. This is a person that has very deep and substantial experience in creating software-based, IT-based companies. He says the book is well written, the language, content, and messaging is well articulated. It is nicely and seamlessly shares the experiences and results of talented folks working with minimal resources, which is common in LMICs to be innovative, creative, and meet local needs. The examples are effective, the concepts well represented. The fourth referee is a very, very senior international science near Nobel star. This is a person who has collected many of the major science awards. This is a person who has taken his bench-side science to international acclaim, has built 2 companies, and in the later stages of his career has built innovation and incubator systems in at least 2 universities. And this person has the following things to say. This about CCIT. They are doing extremely well in the area of innovation and creative thinking and execution. Getting people excited about things is the first key to success. They have done that. You should be proud of them and how they have evolved and embraced innovation, training, and thinking in AKU, which can be an example to others, not only in LMIC environments. Very impressive leadership of AKU in Pakistan, referring to CCIT. I think what is most impressive is that they have used a number of approaches, techniques to accelerate innovative thinking and execution. I especially like the evolution to go from medicine focus to embrace the social sciences, showing how engagement of all disciplines add to success. Chapter 9 culminates with the evolution from critical creative, innovative thinking to creation to innovation, evolution through learning. Since each chapter started with the quote, let me give you one that I often use. Dream in Technicolor, but Technicolor dreams without appropriate action turn into nightmares. I think that your team has dreamt in Technicolor, but have turned these dreams into action, which has yielded great results. Congratulations, the book should be of interest to many. So to Asamia and all of those involved in the book, congratulations. A job very well done, as acclaimed by 4 very different, internationally savvy individuals. And thank you for this opportunity to be part of this virtual launch. And I look forward to listening to the rest of the day's events. So thank you, and again, good day.
Thank you so much, Dr. Carl, for those kind words. Just a message, could everyone please turn their phones on silent so that, the event could proceed? Next, I'd like to call upon Dr. Adil Haider, Dean of the Medical College, to please share his thoughts with us. Thank you.
Assalamu alaikum, everyone. It's such a pleasure to be here at the MEDJACK launch. I want to start, of course, by congratulating all the authors. And I want to just say and remind Asad about the first time I got to hear about the CCIT, because I think whereas the book is very exciting, I think today's event really shows the culmination of how the CCIT has really made a big mark amongst all of us here at the university and the medical college. Asad, you'll remember maybe 4 years ago when I had no idea that I would ever be back here at AKU, Asad was in Boston to attend the MIT hackathon for medicine. And I happened to be one of the mentors at that hackathon just because I, at that point in time, was working on building a company called Doctella, which I'm grateful that eventually the company did work and it did get sold. And I remember being introduced to the CCIT idea. And when I asked Asad, why he was so interested, he was such a busy person, he was a department chair, and he had taken this time off to, this time not off, but taken the time to really learn how to create innovative ideas and how to teach creativity. He said one of the most brilliant things I've heard in a while, and that was that we have all this great raw talent, that we have these great dreamers, and what he's trying to do is to create a pathway for these very smart people to actually bring their ideas to life. And Asad, when I see this book and I see all the smart people who are with you writing this book, it shows the culmination of this sort of spark and idea that you had, and how all of you've created this culture, this community of people who've over time figured out how to bring ideas to life. And the amazing thing is that this book puts their experience into perspective, and so that it harnesses all their experience and their intelligence so that people who come after them, those dreamers, are able to create reality. So I want to congratulate you and give you a round of applause for doing something so incredible. Now, this is very important. We need more and more innovation in healthcare, and that's why I'm speaking on behalf of the medical college, because only 1% of our GDP is spent on health, and virtually nothing is spent on innovation. Whereas we know that in our world, in the lower middle income context, we need to have innovation. Think about the issues we had with communication, for example, right? Before cell phones, trying to get a landline in Pakistan would take you like 20 years, right? You'd be on a waiting list for 20 years. All of a sudden, mobile phone technology came, and now everybody has access, right, to communication. Before this, communicating with people was extremely difficult. And so this is the kind of leaps and bounds that we're hoping to achieve in medicine. And at AKU, we have a lot of great opportunities that are coming, especially with developing of the electronic health record, with the boom in teleconsultation, partly driven by the pandemic. There are a lot of opportunities now for innovation, and I hope that many of us will use this book as a sort of creative pathway, because now more than ever, especially because of the pandemic, there's this whole need for lots of new innovative ideas on how we practice medicine. And this is the time where we need to use our best ability to be creative, but not just be creative, but collaborate. And the other big thing, if you look at the authors here, they're not just a bunch of doctors. They're all folks who help make these pursuits come to life. And so I'm very grateful that you put this book together. I'm also thrilled to see Salim Sayani here in the audience, and the hospital CEO, Dr. Shahid Shafi, here in the audience, which goes to show how much interest there is in bringing these creative ideas to light and then actually developing them. Mr. Sayani is, head of our group that is supposed to bring these innovations to market. And of course, we have the CEO here himself, who would love to see new ideas so that he could implement them right into the hospital immediately. So I just want to finish by again congratulating you and asking and thanking you for building a book that focuses on problem solving and that developmental mindset that will lead us to creating more and more innovative ideas, and for creating this pathway so that young dreamers can end up making a difference. Congratulations.
Thank you so much, Dean Heather, for those kind words. Now, I'd like to call my colleague, Ariba, design mentor and biomedical engineer here at CCIT, to introduce the panelists and get the discussion rolling.
Assalamu alaikum and hello everyone. My name is Ariba Ahmed and I'm a biomedical engineer by profession and a design mentor in residence CCIT and a co-author of MEDJACK Chapter 8. It is lovely to see you all today in person and virtually. Thank you all for joining us today. Today we have an amazing panel with us where we'll be talking about MEDJACK. Not to go buy the book when you are at the book launch, to buy the book. Well, this was really funny by none other than Dr. Asad Mia, Director, CCIT, Associate Professor and Chair, Department of Emergency Medicine, AKU. Along with Dr. Asad, we have Dr. Waqas Akmal, Ad hoc Advisor, Researcher, CCIT, and a co-author of Chapter 3, MEDJACK. Next, we have Shaista Aisha, CEO, Seed Ventures. And last but not the least, we have our moderator, Jahan Ara, former President Pasha, and founder of the Nest.io, member of the Prime Minister's Task Force on Telecom and IT, Director Punjab Port, and Director on the board of CDC. So over to you, Jahan.
Thanks very much, Ariba. It's great to be here and to have such an amazing panel. We've already heard some snippets from what the book is about, but I'd like to get into depth. Also, before I start, I want to announce, this wasn't in the intro, but this is the first time that I am here as founder and CEO of a new initiative called Catalyst Labs, which is an accelerator program and a women's fellowship program. So you guys are the first to know. And so we hope to collaborate more with CCIT on initiatives going forward. Okay, so Asad, since you're the key guy here, talk about the title of the book. Why MEDJACK?
Thank you so much for that question. Hi, everyone. I have my notes. Refer to my notes, I'm just joking. I knew I was going to get that question, and I couldn't potentially pass off that question to one of my co-authors who actually did come up with the name, and I don't know if he has a whole background in his mind. Regardless of that, I think it's important to keep in mind that we went through several different iterations, and this whole process from the beginning till now, and even what's going to come later, it's been constant iterations and prototyping of just the thought process itself. And why did we then finally focus on MEDJACK versus HackMed that was also thought about, MedHack, and all kinds of other iterations, and then finally it's like MEDJACK, which Taha Anwar, who's our IT mentor in residence, he's in the audience. He's part of the IT department over here, academic IT and blended teaching learning in IT. And he came up with MEDJACK based on, I guess, some searches or something. And so what I found out then was that MEDJACK is, by definition, it's essentially hijacking of a medical device. And it's hacking a medical device. And who are we? CCIT, we've been hackers for a few years now, and we run our hackathons. And hacking, the negative connotation, we need to move away from the negative connotation of hacking computers, and then there's a hack is a solution. So you've identified a problem and you want to hack the problem, and so that's a clever way of like coming up with a solution. And so MEDJACK, rather than thinking of hacking of medical devices, we said, let's repurpose that word and give it a positive spin. So we're essentially about hacking different kinds of problems within the sphere or domain of medicine, healthcare, biomedicine. But past that, we've also looked at development, we've looked at social sciences, we've looked at humanities, and ultimately it's just it's anything and everything. So it's pretty sector agnostic. So MEDJACK, the name stuck because of that connection to hacking a medical device and being hackers from that perspective, and then giving it a positive spin.
Okay, makes good sense. So yeah, much like disruption, it can be positive and it can be negative. So tell me, why the need for a book on innovation, and that too for LMICs? First explain what LMICs are, because when I first read it, I started thinking, LMIC, what does that stand for? And then I read bits of the book, and then I figured out what it stood for.
Okay. Note to self, we need to explain LMIC early on in the book, or perhaps better still have an abbreviation list right at the beginning. So LMIC stands for low middle income country, and I guess as healthcare professionals, we get so familiar with this term or this phrase that we just kind of throw it around as if, it's some simple word or something. So based on the income levels of countries across the world, across the globe, the countries are categorized into income levels, so low-income countries, low-middle-income countries, middle-income countries, and then high-income countries, right? So LMICs is from that perspective. In Pakistan, per its GDP, it falls within the low-middle-income country bracket. So LMICs is alluding to that. And your question was why innovation and why specifically for LMICs? Well, as you've read in the book, or we've kind of expanded on that in the book as well. There are a lot of medical issues, healthcare-related issues in Pakistan, and in terms of just very simple, straightforward things, people dying, kids dying, babies dying, women not doing really well in terms of childbirth, and so on and so forth, right? So those are just very few examples of women, infant, and children being affected, but then we've got this huge burden of trauma as well. We don't have very good health systems in place or trauma control systems in place. I'm an emergency medicine physician, so from that perspective, trauma is really of a lot of significance to us. So we have these huge problems, healthcare-related problems, and for years and years, we've tended to have I would say, more of like a research approach to things in terms of, okay, how can we solve these problems, and would a traditional kind of a research approach be better in terms of working out the solutions to these problems, or can we rethink that, flip things on the head, and then what about innovation then? What if we come up with quicker fixes to things? We still need evidence. I'm not saying we should ignore evidence and ignore research from that perspective, but is there room for innovation to address these humongous healthcare problems and then show good outcomes, healthcare outcomes, improved healthcare outcomes based on innovation as your intervention versus more of a research intervention? Although innovation, so then when you delve more into it, there's a very significant research component to innovation itself as well. But that's in the broad, broadly speaking, zoomed out. That was why we've got all of these issues. We've got to address them in some other way, because I don't think just research or education or awareness is going to fit the bill for us.
Okay, so no, I understand that because, for years as president of the Pakistan Software Association, we were always wondering why, it's restricted to just building software for the business community. There are so many problems in education and healthcare that need innovation and that need disruption. So definitely understand that. But why the need for the book?
Sorry. Why the need for a book? That's why write a book? Yeah. So
Sorry,
you agree
I
with
have
me
to
on
be
that? I missed that because I could have condensed all of this. So why the need for a book? And that's a great question. Why does one write a book? And this is not a question I'm asking myself right now for the first time. I am a published author. I've written books before, but the books tended to be, my previous books are on on very different topics and and they served me for very different reasons as well. Why innovation? Well, because we had over the past, I would say 5 years or 6 years, collected enough literature, even our own publications, which were research publications on innovation. And so we had all our papers. We had written original research papers as well as perspective pieces, op-eds, and so on and so forth, and done all of these initiatives, various different initiatives through CCIT, at AQ and beyond AQ as well. And then okay, we've got all of this body of literature. What if we put it together in a book that could be very accessible for people? So I think one of the most important reasons was that we wanted other people outside of healthcare to be able to access this kind of information. And so we chose early on in the process that we wanted to write a non-didactic, non-medical jargony kind of a book, and addressing more of a general readership, perhaps.
Okay. That makes sense. Yeah, much like we in the technology sector use a lot of jargon that people don't understand. And so it's very important to think outside of our immediate community and think along those lines. So how do you see the book helping people from LMICs?
So I think the utility or the potential utilization of the book could be, it's a very multi-purpose book from that perspective. So if professionals are utilizing this book or accessing this book, then it could be as a teaching learning tool. So they can learn about the specs of innovation, creativity, and entrepreneurship, or ICE as we love to call it over here. So ICE specifications for low, middle income or low resource settings, so they can learn about that. And then like Dean Heather mentioned, that it could be kind of like a strategic roadmap perhaps, so people to not just learn but also teach from. And then students can pick up, the medical students, nursing students, PhD students. So, we've got different kinds of students, different kinds of schools. Healthcare is a very vast area, right? Different disciplines. And so they can utilize the book as a learning opportunity and also to implement. Because another very important point about this book is that all the chapters are meant to be toolkits for the reader. And if he or she doesn't feel very comfortable about their own creative skill set or innovation skill set, we want them to kind of own their own creativity, innovation, and entrepreneurship skill set. I was fearful before, a long time back, when I was fearful, I'm not an innovator, I'm not an entrepreneur, I'm not really a creator from that perspective, but I think all of us are in certain ways or another, and it's just a matter of letting it surface. And so this book, through its easier formatting of language, perhaps, I would like to think, non-jargon, people can learn from it. People can just, use it as, I'd like to think it's kind of like popular science, perhaps. It's an intersection of popular science, somewhat academic, but also gets you to hopefully critically think. Are we doing the right things even? I mean, where can we also pivot?
Do you also see it inspiring much more innovation in the healthcare sector, combined with technology?
Yes, I would love it if people find it inspirational, and if the reader finds it inspirational. I think as part of the process, when I worked with my team of, there's 14 of us, yes, co-authors, right? So 14 people I really did not have to convince anyone. I think they were inspired by the process, by what they had learned, hopefully they had learned or picked up through CCIT, and by all of us have been at AKU. Not all of us are right now currently employed at AKU, but we've kind of been through the AKU frameworks and processes, and so we've kind of imbibed that culture as well that keeps us questioning and critically thinking as well. And so I think inspiration, going back to your question, will people, and we really do hope that people do find this inspirational as well, and not just teaching, learning opportunity, but also inspiration. And inspiration can strike you at the least expected of moments as well. So,
okay, another tough question.
Yeah.
So what does innovation mean to you?
Yeah, so I can tell you what the book says, I can tell you what the papers say, and what I've written in academic papers. What does innovation mean to me? I think innovation to me is really reinventing myself. So if I think about my personal definition of innovation, and this is a very personal thing to me as well, that my reinventing myself, whether it's because of life events or just thoughts or people or talking to people and so on and so forth, whether it's personal or professional, it doesn't matter. I think it's just that ability to reinvent oneself, and for me that becomes my personal motivation to keep innovating myself as well.
Good. So next question, what are the challenges that you faced on this journey in coming up with MEDJACK, the entire journey? I know there are lots of authors.
Yeah,
and we will come
wondering.
to questions for Vakas and Shaista and other people in the audience. But were there any specific challenges that you faced on this journey?
Challenges are always there. And it's not because if we just focus this on the book, I'll just say, okay, but let's go back. let's go back 6 years. The CCIT, whole journey of CCIT has been a challenge. Every step we intervene, we do something, there are challenges. But we flip that on its head and we say, no, wait a minute, yes, the challenges are there, but we could create opportunities out of those challenges. I know it's a very cliched thing to say as well, that challenges could be opportunities. But for the book, it's no different. There were challenges. There were challenges in getting 14 authors to actually work within a timeline. So there were several months. This is a 1-year process, by the way. So 1 year for a book of this kind, I think we've managed to do something quite remarkable, if I may say so, for a book of this kind by 14 authors and managing to publish it within a year or slightly under a year. We've had our challenges, we've had our failures, our rejections through to 2 or 3 different publishers before we found Seed Ventures, and we're going to get to Seed Ventures as well. So we did the rounds. We had our failures and our fears mounting as well, that, okay, maybe this is not going to be seeing the light of day. So those kinds of, and then operational challenges, drafting, then designing challenges. And I know Khushal is sitting over here. He's with Shaista's team, and Khushal and Ali, who worked on the digital development of this book, which in itself ends up being a prototype. I made life miserable for them. Along with some of my other close team, CCIT folks, we're not letting you off. You've got to change this, change that 10,000 times. I'm sure we've had so many iterations. So those are challenges, right? When your day job isn't this. I'm not an author or writer from that perspective. But it's just been so interesting, this whole journey of working with 14 people and then a team like Seed, and then the innovation champions. We've had such a fabulous response from people within AKU, outside of AKU, who haven't even read the book or the manuscript, but they were willing to endorse it, even without reading it. So I think they believe in what we've been doing. When you just told them it's about our own journey, and you know what we've been doing. We've been doing hackathons or Ignite sessions or Innovation Fellowship and so on and so forth. And these people have been our mentors. You've been part of our journey before. Sarah sitting over here, Rifat sitting over here from Sehat Kahani. So even Shaista and Faraz of Seed have been our partners before. So it's not just limited to MEDJACK. This journey has been ongoing from before, several years.
Okay, let's bring Waqas into the conversation as well. So both Asad and Waqas. So tell us a little bit about the composition of the book. Tell us about the co-authors. How did you decide on chapter delineation for the writer? It's a complicated process, especially when you have 14 authors. With one author, it's fine. He or she can decide, what I'm going to do, what language I'm going to use, how the flow is going to be. Is it going to be in the third person? Is it, all sorts of things. So how did you guys decide on how this was going to move forward? But first, tell us about the composition of the book and a little bit about the authors. Most of them seem very, very young. So, I'm judging from, I'm judging from the photographs, and of course, a few of them I know. One of them used to be at the Nest.io. One of them used to work at the Nest.io, and then one I have known since he was born. So, most of them are very young. So tell us a little about that. So Waqas, if you can start, and Asad can jump in.
Hello, everyone. My name is Waqas, and I worked at CCIT for a period of time. And I authored chapter 3, which is about hackathons. So when we were starting out with the book, Asad had this list of things that we wanted to cover. And if you could see the first draft of the chapter list, you would see that every chapter began with the word CCIT. So it was CCIT Ignite, CCIT Hackathons, CCIT Innovation Fellowship. And back then, we thought that we might have to compromise with publishers and release this as a bit more medicine-heavy book. So it was in that spirit. But over time, we decided it just would not be far-reaching enough. And that was a period of time where we were trying to decide on what we want the spirit of the book to be, who is the intended audience. And So we made the chapter titles humorous. We introduced some element of a joke that could be made at the end of the chapter. And we composed it, I would say we composed it chronologically. CCIT at the start, and you could see that in chapter 1, it's setting the scene. So we talk about how at the beginning in this university, there was an absence of an innovation hub, and some people took it upon themselves, medical students, volunteers, Dr. Asad. And they slowly worked on things. They found niches that they could exploit, that they could inhabit and bring to life. So the first thing CCIT did was Ignite sessions, I believe, the first proper event that they held. And then they expanded onto hackathons. And then hackathons would lead to startups forming, and so we have the chapter on incubation. And then once CCIT had a foothold, once it had a proper employment structure, once it had found its niche in AQ properly, then it expanded into hiring innovation fellows. And so once we cover all the things that we did, all the tools we employed, and all the spheres that we have touched, then we go on to a breakdown of the themes in them. For example, tech and narrative medicine, cross-disciplinary action, collaboration within the university, without. And of course, there is this chapter on spirituality that I'm actually very fond of. And that ties into it a lot more than you would expect. It's also a very important part of the process. So I would say that that's the composition. One way you can look at it is chronologically, and in the same way you can look at it as a hero's journey from nothing to something, and the lessons learned along the way. Another way you could look at it is in a hub and spoke sort of model, in that there's a central theme, innovation. And there are many different ways to go about it. Each chapter represents one of those ways, and each chapter also answers a question that a person, a layman, might be asking, like, I find myself in this sort of relationship with the healthcare system. It could be anything, could be as a patient in pain, could be as a breakout entrepreneur who wants to do something in this field. I've talked to a lot of engineering students, and a lot of them are very interested in doing something healthcare related. So for any one of these people, they have a chapter to jump to and figure out what they want to do about it, because we have included our own experiences and our own case studies, and we, the intention is that anyone who approaches one of these chapters would be able to find some place to start from, find a definite practical way to go about it, and if not, then it leaves doors open. They could come up with more questions, and they could contact us about it. Things like that. So I think that's it for the composition.
Yeah. What about the authors? I'm really interested in knowing more about the authors.
So the progression of CCIT was such that it began in the medical college, I believe. And the first employee, Walid Faruqi, was an 016, graduate from AQ. And the next employees were Haider Ali and Sarosh Madhani. So this was the first team, the first core team, I believe, Asad, Walid, Sarosh, and Haider. And they were the community managers. I think that was the model we were operating under. Dr. Asad, the core director, and 2 community managers. Then there were mentors in residence, peripheral people who were taking care of one particular thing. So there was an engineer, biomedical engineer mentor in residence, there was a communications mentor in residence, and a tech mentor in residence. Namra Aziz, then replaced by Ariba for the engineering arm. I was the communications mentor, and Taha was...
He's disappeared.
Taha was the tech mentor. There was Rafe, who was managing the incubation space. Am I forgetting?
Yeah, I think that's good. I think we've covered most people. Then we had the innovation fellows who became our...
So once we had that established, once we were able to establish ourselves in AQ, able to get messages around, able to cover all possible spheres, all the networking, we hired innovation fellows.
Yeah, so we had 4 innovation fellows. That was our batch of the first batch of Innovation Fellowship that was last year. And we had Eamon, Mohsin, Komal, and Mariam. And 4 people representing 4 very different fields, right? So we had a pharmacist, nurse, biomedical engineer, and an occupational therapist who became Innovation Fellows. They became our co-authors as well. So the core group, CCIT, as well as our Innovation Fellows, and those are the 14 co-authors.
And with the Innovation Fellows, Dr. Hassan was heavily involved. He sort of designed the curriculum.
So Hassan's here, and he's a faculty member from Community of Health Sciences, and he is part-time with us as entrepreneur mentor in residence.
Yeah, he's also a nestling from my Nest.io, yeah. So I know when I hire or when I look for innovators to join our incubation or acceleration program, there's certain criteria, there's certain things about the people that you want that you're looking for, whether it's passion, whether it's interest in medicine and yet outside of medicine. What were you looking for when you put this group together? Was there anything in your mind of the kind of people that you were looking for?
Is a question relating specifically to the co-authors or CCIT? Because this is the CCIT universe as well, right?
Yeah, that's right.
So
Some of them were with CCIT as
all
well.
of us, actually, all of these.
All of them,
of them, yeah.
So then, who were you looking for?
Yeah.
What kind of qualities were you looking for when you were putting together this group? It's not easy because to get people from different disciplines and also people whose interests may vary, it's difficult to put together a team that can then gel together. So what did you look for? Because it seems it worked. So maybe others can learn from that.
That's a great question, and I'm intrigued by how there's been a superpositioning or something, right? So the same people who are the co-authors were actually CCIT as well, right? So it's not 2 distinct sets, really. And so, to address that question about the book, then it'll answer the question about, what are we looking for when we hire for CCIT? And it's I haven't really given that much thought. The people over here, some people aren't here and they're present virtually, Walid, for example, and Sarosh, and I think we have a few questions for them as well.
Yeah.
So from a very natural, organic perspective, people or students from the medical college, they just gravitated towards CCIT because I started this journey with 2 medical students. This is a long time back, 2013/2014. And those 2 4th-year medical students at that time and myself, we would just get together and talk about what our frustrations were about clinical medicine and what could be done. And obviously, we didn't have any notion of an incubator or an innovation hub or something like that. So it started off as just volunteering our time, and the group became bigger. Again, volunteers, because those med students would then go talk to some other med students. Med students would go talk to nursing students, and so on and so forth. So everything was like a kind of like a the circle of influence, perhaps. It starts small and then kind of spreads, and people just kind of gravitate towards it and it's a very select group of people. The kind of things that we talk about or we discuss in our sessions or in our meetings or what really excites us, I don't think it will connect with everyone. And so do we even want to then go out looking for people? And we don't do that. They just kind of come to us somehow. I think they just kind of heard about us, and then they might have a bit of that basic interest, a bit of curiosity is one thing, but I was thinking of craziness.
Okay.
A bit
Definitely craziness.
So this is wild, mad lot that we just don't know. I mean, at times it's like, okay, why can't we figure out ways of dealing with something, right? Problems have been identified left, right, and center. And I'm not just talking about clinical medicine. I'm talking about any kind of in our teaching spaces or in our research spaces or even outside of work, at our homes. So we identify problems, then we just vent about them, but can we solve them? And so these are the kinds of people, I think, that they just kind of connect to problem identification and then coming up with solutions that, and we're willing to fail. So it's okay. It's not that whatever intervention we have, it's going to be fine, and it has to be successful. No, it's not that. It's a prototype, it's an iteration, and we can keep improving. So I think that group of people, they were willing to take a risk, and all of them actually have taken a risk. Moving away from the primary field, doing this for a year for the fellows. We have 3 current fellows. They've moved away from the primary field, and they're willing to dedicate it to 1 year of a trained experience over here, right? So I think I see that there's a bit of like curiosity, like you rightly pointed out, but there's a bit of like perhaps the intangible as well. We don't know at times why we do certain things, but we just do them. And I felt that for myself as well. At times I just don't know, I can't give you an explanation as to why I do something, but I just know that it's the right thing to do and I just do it. So it's a bit of that as well, perhaps. I don't know if I've answered your question.
No, definitely. And you're right, failure is key if you're trying to be an innovator or if you're trying to create something, disrupt something. Unless you're ready to fail, you're not going to even try because you can't be risk averse in those matters. Okay, so I'm still, Vikas, I still want you to address this one question. I think both of you didn't manage to do that for me. Is that you have so many authors. Was there some sort of briefing, how many words, what is the language going to be like? Because you don't want the book to seem to be jumping from one type of language to another. I don't know if Shaista got involved at that stage and Faraz got involved, but how did you manage that? It's really amazing that it happened and it turned out so well. I know you're not going to tell me about all the things that happened in between, but as long as the process worked.
Well, so even while we were thinking of the chapters, everyone did have an area of expertise that they were best suited to write about. So for me, like my chapter was about hackathons because I had participated in 3, and I had a good hang of it. So I knew what to talk about. My work at CCIT was about researching hackathons and their possible implementation. Sarosh was instrumental in Ignites, participated in them, organized them a lot, and so on and so forth. Everyone has a very key interest in the chapter that they wrote. So that's, I figured that's how they chose their chapters. And there was a chapter list and they picked it out, what they would want to write on. We decided that the chapter word limit, we assigned a word limit, so 3,000 to 5,000 words. We give this, we said that there should be a lot of images. You should try to use pictures more than words. And as for language, that was actually just a boring, extensive editorial process. It was like lining all of them up, seeing like if there were inconsistencies, if the writing style needed to change in some places. But surprisingly enough, I think it's because some chapters got done earlier than others. So probably 1, 9, 3, 4 got written first. And so when we gave them to the rest of the authors, they knew what style to work off of. So it was smoother than you would expect, actually.
Okay, yeah, you want to add to that?
I just want to add to what Vikas was saying that I think one of the, and if this session is being utilized as like an opportunity for others to learn, okay, if they are thinking, or if somebody would like to put together their content, and if it's authored by multiple people, I think a centralized kind of an approach, after having a bit of decentralized kind of thought process or discussions, you've got to have, I think, in my opinion, you've got to have a centralized approach. So there's like a central coordinating body, if I say, and if that was me, then coming up with, okay, these are your guidelines, like Vikas pointed out, like 5,000 words. Initially, it was 10,000 words. Most people, most of us, just could not hit 10,000 words, so you started dropping it. So it was 10,000, 8,000, 5,000, 3,000, that's it. You can't go below 3,000. 1,000-word essay, this is not an essay, this is a chapter, okay? So that kind of a thought process, right? And then just kind of following through on that. Where the chapter authors are concerned, I think it was interesting. I think it was a more of a interesting phenomenon that was occurring because I had a lay of the land, being the in age being the oldest person in the group, as well as, okay, I've seen it from the get-go. So I kind of knew where these individuals, when did they come on board for CCIT, and what were their strengths. So I wanted to play up on their strengths, not so much that, if there are certain weaknesses and then I need to put them into a chapter so that they can improve their skill set. That wasn't the point. It was, okay, what was the strength that this individual brought? And then what was their professional background, for example. So the tech chapter, for example, which was authored by Taha, Namra, and Ariba, all three are engineers. Taha is also an MBA. So it was kind of a natural no-brainer. Okay, we've got to have engineers working on tech, tech's linked to innovation. And the full title is The Link to or The Road to Immortality. So that was the challenge for them. How do they connect tech to innovation to immortality in 3,000 words or so? Okay. So, and a lot of iterations, and these chapters went through I would say easily 15, 20 iterations each, if not more.
So, okay, in the IT industry, what happens is when we are developing software, we're looking at whether it's relevant for the local industry, local consumption, or is it relevant or can it be used in other parts of the world? So I'd ask you about MEDJACK. Do you think it's relevant for any other country in the world, maybe more LMICs or even developed countries?
Great question. So I think, Jahan, that that this content is exceedingly relevant, no matter where you are in this world. Now, I'm not just saying it because this is my work or my team's work. That's not the reason. We've made it a point that for each chapter, for each thought process that was coming to the surface for any of those chapters, the relevance globally had to be emphasized. So yes, we're starting off local because we're saying low-cost innovation. We are part of we are in a low-middle income country, but the message is very global. Even for high-income countries, what the pandemic has demonstrated is that no matter how much money you have, you will run into issues. The US is a great example, cutting edge biomedical technology, but one of the worst outcomes or worst scenarios where COVID is concerned. So where's that disconnect? And so it's not just that, I think it's process. It's process, it's the mindset. That it's not always that money is going to be the answer. It's people, it's teams, it's your mindset, I think. And so that's something that we've tried to emphasize again and again in this book, just to make it globally relevant and not just for healthcare folks. It's innovation at a systems level. And so what are the challenges for the system and how can you work around that? How do you incorporate processes so that your system is able to endure where innovation is concerned and where creativity and entrepreneurship are concerned as well. And hence the progression of the chapters is from, yes, somewhat historical as well, but then also from the less kind of work intensive to the more work intensive, to the more techie based chapter, and then ultimately innovation for life. Delving from medicine into humanities, social sciences, and then innovation for life where spirituality is concerned. So I think it's that thought process that, it doesn't matter who you are, what your discipline is. If you're intrigued by creativity, innovation, entrepreneurship, then this book could help you get onto that journey. Because it's a journey at the end. I think you keep learning.
Okay, Vikas, would you share a little bit about how you critically evaluated the book, and especially the chapter titles? How did you go about selecting or creating the chapter titles? Was it you? Was it a group effort?
It was me. And,
okay, great. So tell us how you came up with those.
Well, okay, so one-liners. CCIT has this internal process called the pun score. We try to make the worst jokes possible at any given moment, and then we count how many everyone came up with. There's a strict competition about that, so I think that primed me for the job. And I think I just wrote the first thing that came to mind, really. And something that was critically related to the topic. So for hackathons, it's teaching a doctor how to fish or teaching a healthcare professional how to fish. And fishing is, it's this very popular parable about teaching a man how to fish, because it's better than just giving charity. It's to give a skill set is sustainable, it's better. And when you get into a hackathon, you realize that it's teaching you things that are very necessary for startups to survive in the real world. And if someone's like saying, you know, here's a bunch of money, go make a product, you're not going to go very far. You actually have to start from the ground up and learn. Yeah. And similarly, for most of these chapters, the narrative medicine as the healthcare shoe exchange program, because when the doctor writes about what they go through while they treat a patient, they go over a lot of things that a patient might not expect that a doctor feels, because their experience of a doctor is limited by time and by their own condition. But when the doctor presents their view of it, it can be humanized, it can be experienced by both parties at the same time. And so I guess I just tried to capture the essence of that, the one thing that's really supposed to get through in that chapter. And the lesson is moral? There's a moral of the story, I suppose.
Okay, terrific. Okay, Shaista, you've been spared long enough. Time for you to join the conversation. So why did Seed Ventures, first of all, decide to publish this book? And secondly, why an ebook?
So, okay, so there are like several things that led to this. You know, when Asad came to me and he came to Seed with the book and the manuscript, before I had joined Seed, I was teaching at a local university for about 6 years, and I was teaching subjects like entrepreneurship and innovation. And one of my greatest frustrations was that we did not have any local material, any local examples with respect to entrepreneurship or innovation to teach kids at the university. It was all international, a very Western viewpoint, nothing to teach them about the context. And I kept wondering, you know, we're trying to create entrepreneurs for tomorrow who are going to solve problems here. But we don't talk about the problems that exist here, and neither do we're not developing the approach of how they can, you know, resolve these issues. So when he came with the book, you know, some of all of that came rolling back to me, and I got very excited when I got through the manuscript and I had a chance to go through it. And, you know, I couldn't believe spirituality and the healthcare industry were in the same book. I was like, how did he manage that? You know, he's talking about Ikigai, and I was like, how did he manage that? And I was like, but he did. And I didn't feel it was a very medically heavy book. I thought it had the potential of having a very universal audience, because I felt that, well, at least for the first time in Pakistan, something had been written that could be read by young people, that could inspire them to think about innovation, that could help them sort of understand how basic innovation is to human nature. You know, it's like part of our DNA. It's what sets us apart from the rest of the species, because we're programmed to make things better, and somehow, you know, because we get jaded with life, we forget. And we need to be consistently reminded. And I felt that this book had that potential. So, you know, I, as a person, got really excited. And that's like one of the 90% of the reasons why we wanted to do it. Other than that, I think this book has great scope of opening up so many windows and conversations with people outside of Pakistan. And, you know, helping them understand how they can possibly work with us, how entrepreneurs, engineers can collaborate with the healthcare industry and come up with really brilliant solutions. So, you know, that's one of the big reasons why we decided to do this. And why an ebook? Well, because we wanted to, going into print, so you know what happens with printed
Keep the costs down maybe is one reason.
And also, you know, it sits on a shelf. And if you want to sort of have a larger outreach, and go international in lower cost, ebook is the way to go, and it's eco-friendly too. So, yeah.
Okay, great. So, Asad, what would your message be for innovators, mavericks, crazy people, anybody who thinks that they want to try something that's different from what other people are doing? Would there be a message that you would have for them?
Yeah, I was just well, basing this off of my own experiences, just do it. just go ahead and, express yourself. Obviously, that doesn't mean you start disrespecting people or anything like that. But but then when I think about it further, if you give yourself too much of a rigid framework of expression, then that kind of boxes you back into that box, right? So, but if you want to try out something, you've thought about it and you've let it percolate in your mind, and you still have the passion and desire to go ahead and do something, just go and just do it then. And so my message to people who, depending on how, I'm not really getting into details as to how does one define a maverick, or who is a maverick, or who is really an innovator. I think in certain ways we all have the potential and the capability. So let it express itself. It's fine. I think a lot of times, and I was having a discussion with my team just a few days back, I guess, and this kind of thing, why don't we do more of these things? Even as an individual, why is it that we don't share our creative expression with anybody else? I mean, if we're writing, then we tend to keep writing in our own journals, but we never share.
We're scared.
We're scared, right? So it's fear. I think it's
else.
fear. It's judgment, that we're fearful that somebody's going to judge your work. But if you unless you're able to break out of that, and then I think it becomes really difficult to keep improving your skill set. And it's not about becoming famous or money or business taking off or something like that. I think it's just once you realize you're just part of this journey, and it's amazing. You keep learning, and you fall down, make mistakes, you get up, you keep going. That's about all you can keep doing.
So it's more about problem solving, and
yeah, ultimately
we're very lucky here. Everywhere you look, we have a problem, which
we're
is
good.
an opportunity.
We create problems if we don't find them, so you can just create them as well.
Right. Okay, Vikas, so how is the content of the book relevant for students within healthcare and outside healthcare? Have you thought about that?
We did consider that, yes. Well, for medical students, it's they go through this process of rigorously learning and imbibing this ethos of medicine that, well, for one thing, you can say algorithms. A doctor's judgment is not usually perfect. An algorithm can outperform a doctor by a certain percentage. So you should stick to the algorithm if you want to do right by your patients. Now, this ethos trickles down into other parts of the way medicine is practiced. If you're going to give a patient a drip, you need to make sure that there's a certain difference of time between one infusion and the other. There's a very complex and a very good reason for that, because the patient can suffer otherwise. So you need to remember that. And there are so many different things of the sort that you need to remember that look arbitrary on the surface but have a very good reason, a potentially life-saving reason, or a life-ending reason, that a medical student will, by the end of their journey, always try to refer to another source when they try to come up with a decision. And that could be harmful in many ways, because what people don't realize is that medicine and healthcare in general, it's huge. The amount of stakeholders in this business are huge. It's not just doctors, nurses, health practitioners. It's the infrastructure itself. It's public health scientists. It's accountancy. There's a lot of computer science going into it. There's the way the data is handled, the way registries are done. And the only thing about the system that is fixed is medicine. Everything else is free real estate. So I think a doctor needs to learn that, a doctor in training, a medical student needs to learn that there are only very few things that are actually fixed in medicine. And there are many, many more opportunities to hack and improve on the infrastructure. and make things better. And I think a lot of what burnout constitutes is that a person does the same thing over and over so many different times. And we have done this for so long. We've been practicing these things for so long that we already have enough statistics about the failure rates and about the false negatives, the false positives of a test, that you know that you're going to fail this much of your intended patients. You don't have to, not necessarily. And I think students really need to get that in their heads from a very early period of time. And I think the book can really help them with that. For students that are not medical students, similar thing, but maybe a bit more greed-oriented. Healthcare is very fertile ground. Lots of opportunity. Please pay attention to us.
Terrific. So are Komal and Sarosh online? Do we know?
Yeah, I'm here.
Yeah, me too.
Okay, so tell us, we want to get more people involved in this conversation, and since you're authors, how relevant is the book in terms of engaging medical students and nursing students in the ICE process?
So, would you like to go first?
Sure.
He looked a bit traumatized there.
I think within, speaking from my own experience, when the medical system, the medical college system within Pakistan is such that you have, students coming out of high school going directly into medical school, and they have this huge amounts of energy, and they have these ideas and stuff, and then you put them in medical school, which is a noble profession, but they're bombarded with like all this medical knowledge and all that stuff. So they sort of get in this restrictive sort of an environment where it's just about medicine and everything. And they sort of lose that spark of being innovative, of thinking outside the box. So it becomes very important to have this sort of a platform or this sort of a guidance where they can actually combine their other interests with those of medicine. Like I know of so many people within the School of Nursing and within medical college and within other schools of AKU who have other hobbies and stuff. They have these businesses, like they cook, they bake, they make clothes, they do a lot of other stuff alongside their medical.
Do they find the time if they are doctors?
Absolutely. So they have the drive for that. They just need a platform which could actually help them combine those interests and work towards them. And that's what happened with me. Speaking personally, I had a crazy idea. I met two crazy people. I met Asad and Walid, and they supported my craziness. And then here I am. So I guess that's why it's important that you have talented young individuals who want to combine their different interests with medicine. And this is the platform for it.
Good. Komal, you're next.
So for me, it was a bit different. And when I think about this question, it takes me back to the time when I was doing my nursing internship at the Khan University after my graduation. And during that time, I did not know much about the world of innovation that existed at AKU. However, when I was working, because I was just an intern and I was working with these nurses, so I did witness a lot of nurses innovate and come up with creative solutions almost on a daily basis. But the only thing that it was never recognized or acknowledged. And then our traditional nursing education do teach us about how to think critically, but does not provide us with a structured problem-solving approach, like how to do it and how to think innovatively. So after my internship, I met the team CCIT and learned more about what they were doing, and then I came across this innovation fellowship in 2020. So during that fellowship, I gained a lot of skills and learned the various aspects of healthcare innovation in collaboration with so many other diverse people, like Asad mentioned, the diversity in the fellowship program. And now, when I look at it in the retrospect, I feel that if I had been introduced to these skill sets during my nursing education, it would have helped me a lot to think not only more innovatively, but also more empathetically. So I feel that this book talk about various aspects of innovation that CCIT has tried and tested over the years. Like, for example, narrative medicine, which I have co-authored with Heather. So this chapter talks about the art of storytelling, or the other chapter that is Jugaad Innovation, which talks about the frugal innovation in times of COVID. So I feel that these are all the guidelines for these students, and these aspects will help in the development of nursing students into those professionals who are empowered enough and equipped with those tools to improve the healthcare, not just in collaboration with nurses, but with pharmacists, with engineers, with doctors, whoever is that in the space.
Terrific. So you mentioned Heather. Is he available to us right now? Because then we can ask him a question too. Is he online?
Yes, I am.
I
hopefully.
don't. Yeah, I don't see you, but anyway,
Okay, I hope you guys can.
I'll believe
Okay.
you. Okay.
Okay, I hope you can see me now.
Yeah, I can. So Komal mentioned empathy. So how important do you think
Yeah.
empathy is with reference to innovation and the process of setting up an innovation hub?
Yeah, so firstly, thank you so much for the question. And then more importantly, thank you for coming and taking time out of your busy schedule. So for me, when I think of empathy and problem solving and innovation, what comes to mind is impact. So if you look at impact historically, if you look at any research, any invention, any innovation, any business that's successful and that's making impact and making basically people's lives better, it's based on empathy. And why I say that is because it solves a problem. For anything to be impactful, it needs to solve a problem. So yeah, for me, empathy is basically the root for all innovation, and basically empathy is the root, basically the way that we can make the world a better place. And then when I think about empathy, right, that part of the question was how do we cultivate empathy and a culture for empathy? So if you look at the word empathy, the definition that comes up is to be able to share a person's feeling, to be able to feel the same thing, to be able to understand their feelings, and to be able to know what their problems are. And the only way to cultivate that, in my opinion, and like from what I've learned, is through curiosity. And curiosity is something that, I believe should be, like part of nature of everyone that's out there. Because personally, it has helped me learn a lot because, when you make it a habit to question any and everything, and, you open yourself to experiences and, new things, you do learn a lot and you do grow as a person overall. So yeah, to be able to cultivate a culture of innovation and, to be able to work towards a hub of innovation, I think cultivating empathy is, I think, the most basic core value that needs to be there. And without it, I don't think it could work. So yeah, I hopefully answered it.
Yes, you did. So where are the three of you? Which part of the world are you in?
I'm currently on my leaves in Islamabad.
Okay.
With my family. Yeah, I'm currently working at AQ with Dr. Adil Haider. I'm currently managing and setting up the Clinical and Translational Research Incubation Center at AKU.
Okay.
And over to the rest of you.
And Komal?
And I am in London, and
Right.
I'm doing my master's in global mental health at King's College.
Okay, and Sarosh?
I'm actually working as a researcher in the Mayo Clinic in Rochester, Minnesota.
Okay, so we have people from very diverse locations. All right, where's Namra? Namra, you're not going to be spared either. So your expertise is bioengineering. So tell us, with reference to bioengineering, how helpful is the book for future innovators? If you could shed some light on the connection between bioengineering and innovation, because now that you are no longer at the nest and you're going to start your startup, this is a question you should be able to answer.
Oh no, disclosing secrets now. So I think biomedical engineering per se is more hit in the tech chapter, chapter 8, that I wrote with Taha and Ariba. I think we wanted to basically address biomedical engineering in a few different ways. The first was a more generalized view of how technology has advanced over the years. Where first it was about survival, and then now I think it's more about how we can improve the way of life and how efficiently we can basically address people's needs. And then for innovators per se, it goes into this process flow of how you can use the lack of resources in a lower middle income country such as Pakistan and basically address any problem and as efficiently as you can, and then eventually commercialize it. If that answers that. And then a link, I think innovation in itself such a broad term. But in biomed, how I think of it, it's more obvious when the need of the time arrives. So, I mean, right now is the biggest example with the COVID-19 vaccine, where that initiative from all over the world in biomedical engineering to address a need came about. And basically, people come together as to how fast and efficiently we can address a problem.
Great. Thank you. Okay, back to Asad and Shaista. So what's beyond the book? I know it can't stop with the book, right? Do you have any other plans? Tell us about them.
So I see this as an opportunity of creating a community of innovators, and it always excites me how we can share the work that's being done in Pakistan with people outside of Pakistan, and what can be done in terms of collaboration. And I see the future as solutions that are actually being developed by innovators in Pakistan and innovators out of Pakistan collectively, and looking at how they're employed in the ecosystem, in the healthcare industry, actually seeing that happening. And I think that would be a win for us, and I would love for something like that to happen. So it doesn't stop with the book. It actually begins a conversation on innovation.
Yeah, and I agree with what Shaista was saying. And so I think it's meant to be a conversation starter, really. And partly the reason why we weren't like all that gung-ho about the print copy, Shaista had mentioned that, just putting it on a shelf and then forgetting about it versus having a digital book, which I think also gives you the ability of prototyping as well. The book itself can evolve. A prototype, a digital prototype can evolve. We learn from other people and they give us feedback, and then we can improve those particular chapters as well. So the way I look at what comes next is, I think, okay, depending on what we can do short term versus intermediate versus long term. And I think we can do something or another along that whole spectrum. Short term, obviously, right after this launch, we will be kickstarting our webinars around MEDJACK, and several people, you included, and our other panelists, and so on and so forth. So we want you to host individual, we host when you become our speakers, and you talk about your own work. Under the ambit of MEDJACK, but then again, within that, if we could kind of connect these people, individuals, different organizations, different startups, and make that connection back and forth between MEDJACK, and then we have entity XYZ, and then the back and forth connectivity. So it's really a huge network of connections and interlinkages that we can enhance through this process. So webinars, podcasts, and that's something that we really will get going on as soon as this, maybe tomorrow. No, just joking. No, so that's and other things, obviously, that whatever good things come later.
May I also suggest that you consider an iBook, so that you can have linkages to videos, and there could be animations, and it could be really crazy.
I don't know, Kushal is sitting over here, and Kushal and Ali and Shaista can answer that. It's her team.
We can definitely look into that. Yes,
yeah,
absolutely.
It's so interesting, because reading is not something that a lot of people, especially in this country, do.
Yeah.
And that would sort of engage a lot more people, and they might
We'd love your
encourage them to
input
read.
on how we could make it more interactive, because I think that's going to be the key to this, right? So, and also I think, in terms of getting conversations started, seeing how entrepreneurs in the healthcare industry can engage more.
Yeah, there are a lot of people, including Sarah and Ifat,
Yes.
who have come up with innovative ways of accessing healthcare, and this country certainly needs it. So I'm sure you can engage a lot of healthcare entrepreneurs across the country, people who've studied medicine but don't actually want to practice it, but want to use the knowledge that they have. And of course, interdisciplinary interaction, engagement is very important. Okay, is Dr. Khan Siddiqui online? He's in the US, right?
Yeah, he's in Chicago.
Okay.
What's the time?
Oops, that's me,
That's
not
you.
him. Shaista.
I think we told him like 6 or 6:15ish.
What time is it now?
It's 6:30.
We should have set an alarm for him remotely. Sometimes the line drops, so. Okay.
Can you guys hear me?
Oh,
Yeah, oh yes. Welcome. Are you up and
Thank
about?
you. I've been up and about for a while now.
Great.
CCIT was after my first 2 conference calls in the morning, so
Have you been listening to our discussion?
I have been. Very
Okay.
fascinating, very inspirational discussion.
Okay, so since you're an innovator, my question to you is, if you could tell us a little bit about your experience as an innovator and your association with CCIT, how has that transitioned over time?
Yeah, I think I'll start with my association with CCIT first, right? I remember it was 2014 when Asad reached out to me for the first time, this idea of Ignite. And I was really fascinated how, thinking about it and, sitting in the US, sometimes, I'm based in Chicago right now, you can always have your egos and all the best. And I was completely humbled by the first Ignite session I attended and really opened my eyes. I'll tell you how naive I was in those days. I didn't know what LMIC meant, right? My first understanding what LMIC was.
Me too.
Was through an Ignite session, and it completely changed my thought process, how I think about innovation and what I do. And I know Asad and other fortunate thing I've had. So I've been involved in the Ignite session. Then Asad invited me to judge one of the hackathons, and then I came to AKU to mentor one of the hackathons also. And then since then, I've had multiple AKU students who've actually worked for me in different companies here. I mean, even currently, Burhan Khan from 2018 just did a whole year of internship with me on all aspects of entrepreneurship. So it is great that, the inspiration that Asad is creating is actually now taking some med students to come and actually do some kind of entrepreneurial work in a startup and see how, take it to the next level, right? So now you've done the hackathon. Now, how do you actually take it and commercialize, build products, scale companies, hire people, do the fundraising and all that aspect of it? So it has been an amazing learning for me through the whole process and really inspirational for me. I'll give you some other examples. I invited Asad and Sarosh, both came to Chicago, just went through what we do from our point of view, but also I wanted to experience Carl, Illinois School of Medicine, the first school that was actually, it's a med school that is part of an engineering school that required undergraduation in engineering, and ended up being mentoring their med students, and that entire med school class is like a CCIT. And what I wanted Asad and team to see is that how far ahead AKU is in that thought process. Because I remember, I don't know if you remember or not, and maybe Sarosh does, is that there was a few presentations that they were making that the teams in a hackathon at AKU had already done it a year ago, right? So there were ideas like, they solved better, and a better solution came out through the AKU hackathon than what this engineering school was doing in the US. I mean, UIUC is one of the top 10 engineering schools in the United States, right? I mean, so just wanted to see that, how far progressive, CCIT ideas were and how the team was thinking about doing it. I mean, the wave that Carl Illinois School of Medicine created here is that now there's another med school that I'm also helping mentor is NMed. It's part of Texas A&M, and they're calling it's a combined medicine and engineering degree. And then the people that come out of it are called physicians. So it's a combination of engineering and med school as one entity. So Carl Illinois School of Medicine was come with engineering degree and get your medicine. And this school actually is training them in both disciplines at the same time. So you come out with a PhD in engineering as well as an MD at the same time. So, and it's amazing to see, how that is getting evolving in the US, and how AKU took it much earlier with Asad's help and the team's help, like 2014. Like you guys were like 6 years, 7 years ahead of a lot of people that are trying to think about it now here. And I had also was very fortunate, and not so fortunate for Asad and Sarosh. They got stuck in a snowstorm in Chicago and spent 2 days with me, and just thinking about, how do you think about innovation? And like my philosophy always been, and I'm sure those both will share with this, is that the innovation starts with changing the culture. And the way I've been able to, solve so many problems so many times in different aspects of it is because I focus on building the culture across the entire organization, right? And it starts at the top. If the top, whoever the leader is, doesn't believe in building innovation culture across the organization, it's really hard to do it. And you always end up getting resistance and barriers that you're trying to overcome when you don't have that thought process of how do we build a culture across the organization and continuously focus on problem solving rather than the eureka moment or ideas that a lot of people think about. So that's kind of how I think about it. What's the hard problem I need to solve? How do we solve it? How do we build the right culture? How do we build the right team? And then, one of the things I think I said, and we've talked about, is that how do you build this team with diverse backgrounds? One of the things I always say is you innovate at the edge of your experience. And it's kind of been a lot of my journey, and as a physician, and then going to entrepreneurship and more on the engineering side of things, it's brought me perspective that is very different from somebody coming from engineering point of view or somebody staying in medicine, and this bridge going back and forth between engineering and healthcare kind of helps you think about solutions and problems differently and solve them differently. I'll tell you one of the reasons that my current company here at Hyperfine, we're building this low portable MRI scanner, and AKU has one of the first ones internationally, and this idea of focusing on solutions that not only is addressing the problems in the United States and the ICUs, but also in the LMIC settings. You have to think about it up front so that you can think about the design, think about the solution in the context of how it will be utilized in that space. And I remember there was a keynote at one of the hackathons I was there that talked about lack of surgical talent in Africa, and how the thought process of having non-physicians being able to do simple procedures. So, and as we think about our device, okay, fine, like we can do an MRI scanner in sub-Saharan Africa or rural Pakistan, but then you find the disease, then who's going to take care of the patient, right? Where's your neurosurgeon who's going to do that, and how do you solve the next problem that suddenly imaging has created? So we're thinking much broadly, and that's how kind of once you have that idea of context of what you're trying to solve, what the problem it is, and you're not constrained by the one thing that you've built, but actually understand the entire ecosystem, the problem that you're trying to solve, then you're not limited on how you're addressing the problem, and you can go beyond and address all those things. I hope I'm not being too all over the place answering your question, and was able to articulate what I'm trying to say.
Absolutely, it was clear. And there was a young man who asked Asrar Ali what is in the background that Dr. Khan Siddiqui has. And I hope he got the answer. It's an MRI scanner. I think everybody was sort of wondering why you have it in the background. So now we know.
So yeah, this is I'm always in sales mode, right? So.
No, but one thing you said actually rang a bell, is that very often we in Pakistan underestimate our own capabilities, our own ability to innovate and create things much before what is known as the developed world, right? So we should never underestimate our own capabilities and not think that unless we're somewhere else or we're born somewhere else in the world, we can't solve a problem or can't disrupt what exists. So that really rang a bell for me, because a lot of young people really say, oh, that guy's done that because he's in the US, or she's done that because she's based in Germany, or she had all these things available. But sometimes the lack of available tools, lack of available things all around you actually make you, a mother of invention, sort of. So that really rang a bell. Okay, any questions from Asad, Waqas, Shaista, or Dr. Siddiqui? So
I have to pass. I have to pass I don't know if it's complaint or thing. So I got a call from the dean at UIUC complaining that Dr. Asad doesn't join his dolphin tank sessions.
Asad, you want to answer that? Why do you not?
In my defense, it was meant to be from midnight till 3 a.m. or 4 a.m. my time here. I'm like, I think I'll pass. That was the only issue, Khan. Sorry, apologies to.
I know,
Yeah,
but I had to pass the message along.
Yeah, tell him to look at timings before asking him again. So any questions either from online or from the audience here at the AKU? Come on, you must have questions. There's been, yes. Can we give you a mic? Introduce yourself so we know who we're talking to.
So my name is Kulsum Ghayas, and I'm a faculty member here. I'm also, in some ways, been peripherally involved with some of the many of the innovations that CCIT has undertaken. It's not a question, it's just a comment. I just want to congratulate everyone. It is just not just on the final product, but on this journey that you have all been on. And I think there's so many things that were resonating as all of you were talking, but there was such a moment of pride, I have to say, when Waqas and Sarosh and Komal spoke. I just want to say thank you for everything that you've done.
Perfect, thank you. Yes? Introduce yourself. I know we know you, but introduce yourself anyway.
Hi, my name is Mehreen. I have a question. How can we get a copy of the book?
That is a very important question.
Is that addressed to me?
Or Shaista.
Or Shaista. There's a QR code right over there, and we can give you more and more of these QR codes. But right now, we just have the digital book that's available, and the link is up on Amazon. So we are happy to share the link. The QR code is over here. And so do get the book, the digital copy, and go through it and give us feedback. Love to get your feedback, and we hope to improve on this particular version. The print copy, I think, Shaista, probably another 2 months or so?
Yeah, not yet.
Yeah, not yet.
Yeah. Anybody else? Come on, a tough questions. I know, but you must come up with something else. Or one of the other people who was an author who might be here.
Yeah, I've got to give a shout out to all the, can at least the authors who are sitting in the audience, if they can just stand up, and so
can
have
you all
like
stand up?
Yeah, because we've got Eamon there, Mariam there.
There's 2 people here.
We've got Hassan, Taha, Namra. I don't know if Mohsen is around, but and then online you saw those folks, and then Walid, I believe perhaps is, I don't know. He's in Boston.
Okay,
and,
maybe he's still asleep.
Yeah, he might be. I don't know.
Okay.
And Rafi is on. I don't even know if Rafi is online.
Rafi is online, yeah.
Rafi is online as well. So just a shout out to all the co-authors. We don't have questions.
Well done, guys, all of you. Do you have anything that any of you want to say? I know Namra's already spoken, but the rest of you, anything about the journey, any problems, what made it truly worth your while?
I actually have a question, and I still haven't found the answer for that. So there's a cost that is associated with innovation. And in LMICs, we are already dealing with lack of funding for healthcare. So how do we, and I know that we are looking for the most cost-effective way of finding solutions, but still there is a cost that is associated to developing new things. So how can we create this culture in which we can then somehow jump over this cost issue? So I don't have the answer to that. I just thought maybe the panel can.
Would any of you like to address it? Do you want me to throw in?
Yes, actually, I was going to like pass it off to you.
So that is a problem for all innovators, not just in healthcare. The thing is, you should start first. Nobody is going to give you money unless you have some sort of prototype, solving some sort of a problem, and an investor can see that it is eventually going to make him or her money. So they're not in it for the empathy. They are not in it because they like you. They want to know that this is actually solving a problem. The best of them will first look at whether it's solving a problem, if it's going to become a product, and if it's going to sell both locally and internationally. So in Pakistan, all of you are aware of Ignite, the organization, not Ignite as mentioned in the book, chapter 2. So they give money for just this kind of work, right? So, and that money there's lots of money just sitting idle. I would suggest that you apply for that. A lot of people don't. There are some startups that I know who eventually did. I actually had to hold, sort of a poll over their heads to say, come on, complete that form. I know it's a very, very long, tedious form, but you guys are used to filling up so many things, right? And reading research and all of that. Just do it. There is lots of money that's easily available. It's grant money. You don't have to return it. So I would suggest that that's what you do. But fortunately for us, the investment landscape is improving, the startup investment landscape, and a lot of people from the region and internationally are beginning to see that there's so much innovation happening in Pakistan. And when they can see what's happening, whether in healthcare or in education or in any other area, and they can see the kind of products being developed and the kind of solutions they're providing, they are more likely, because they understand the VC culture, they understand that money is needed to do what you are planning to do. That money will be more easily accessible, and it will be larger in size than what the local VCs have been able to provide. So, it's encouraging. Don't be disillusioned or disappointed or discouraged. Things are improving. I'm really optimistic.
Thank you.
All right, so it was such a great discussion. Thanks to our panel and our moderator. Moving to our next part of the program, I and Marine would like to welcome Dr. Sara Khurram and Dr. Ifat, co-founder and CEO Sehat Kahani.
Hello, everyone. Thank you, Jahan. I think you did a fantastic job. I've sat in a panel after a long time, that too a physical one, and thoroughly enjoyed it. So thank you for giving that opportunity back to us. Assalamu alaikum, everyone. My name is Dr. Sara Saeed Khurram. I, along with Ifat, run a telemedicine company in Pakistan called Sehat Kahani, where we connect female doctors to patients using a telemedicine-based solution. And I've graduated 11 years ago, seems like a long, long time. But when I was graduating, all throughout my medical years, I never heard the three terms that were used extensively today. That was innovation, creativity, and entrepreneurship. Did not cross by any of parts of my 5 years of medical knowledge. So when I started out and I saw a problem in the system that I wanted to tackle, the issue of female doctors not working and not being able to reaching out to low-income communities, I did not know how to start. I did not know what to do. And I learned from people in bits and pieces. So if I met someone like Jahan, she was saying something when she was launching Nest.io, we grabbed that. Then we came to the first hackathon that Dr. Asif was doing, and I still remember very specifically between the first and second session, they danced. I learned, how important it is to create breaks between the work that you're doing. So in bits and pieces, we learn from different mentors in different points of time. If I was graduating in 2021, I would call this book as an e-mentor, because it's imbibing and synthesizing all that information that you get from different people in different points of time, and just putting it as a reference guide for anyone who wants to start up anyone wants to create something which is not available right now. Because what I've realized working in public health in Pakistan is that we consider medicine as Waqas said, if I'm not taking your name wrong, Waqas said, we think and we associate medicine by only doctors providing medicine and fixing things. When you get into the healthcare system of Pakistan, you realize that there are so many problems, and that's why it's a fragmented healthcare system, that it cannot be solved only by doctors providing medicines to patients. You need to fix infrastructure, there's a lack of resources, there are so many broken chains in public healthcare delivery system, and we as doctors cannot be disassociated with it. We as medical students cannot be disassociated with it and only providing care to patients. We need to become a part of the solution. And in order to build something of that sort, you need guidance from time to time. And I think MEDJACK provides you with that opportunity. Coming to COVID, I think the only way that our company and any company now has survived is if they had a quality to pivot and if they had a quality to be resilient. And that's exactly what, again, MEDJACK teaches you, is how you can keep it simple, flexible, taking small steps and finding opportunity in adversity. There are a few chapters that talk about it. And nothing, as someone said, nothing of it can happen unless and until you have empathy and passion for the cause that you're working for. So I just want to congratulate Dr. Asad and his team. I've been a part of CCIT as a mentor, as a judge. I saw when you pitched, I was judging you. I felt so proud sitting, it felt like, you feel very parental all of a sudden when you see children coming on panels and talking. So I think that's what all of you embody. I think CCIT started as an idea that Sarosh and Dr. Asad has, and now it's become a community. And that community is doing great things. And I think this book is just a starting point. And I think Shaista and Faraz and Seed is just the perfect people to collaborate with, because they embody entrepreneurship and student-related entrepreneurship in all the work that they do. So thank you for doing this. I think it's a start of a conversation, goes a long way, and just congratulations. And to all the co-authors, it's not easy to work as a team of 14 people writing chapters of a book. So kudos to all of you for pulling it through. You're like co-founders of a little idea that you generated, and it's not easy working as 14 co-founders. So thank you very much. I wish you all the best, and I hope this book is read by medical students and other students all throughout the world, and they see what you've created, they refer to it, they take knowledge from it, and they build something of their own and build crazy things, just like we think that we're building every day. Thank you.
So first of all, thank you so much for having us here. I think we really thoroughly enjoyed listening to all of you. And I think when I got a chance to look at and glance at a few chapters of the book, I think कुछ चीज़ें जो बहुत resonate की वो ये थी कि when we graduated a decade ago, if you're a doctor and you haven't really done your medical postgrad and you're like really looked down upon, there's like a stigma कि अच्छा doctor बन गए और medicine में post graduation नहीं की, तो ये you're like, you don't belong in the medical fraternity at that point especially. So I think this book say you're kind of legitimizing, कि this is some avenue which a lot of doctors can really take, and I think kind of really legitimizing our journey also कि ये भी होता है, and being a doctor ये भी आप कर सकते हैं, there's so much opportunity that you can actually explore, because there's, especially if you talk about a country like Pakistan जहाँ पे इतने healthcare gaps हैं, and which really need a lot of, I would say, jugaad to actually be filled, and maybe not every solution has to be a really cost-extensive solution, and there are so many things that can actually be done in bits and pieces, and doctors can actually do it. So I think, thank you so much for bringing up this book, which really enables doctors like us who think differently, who want to do something crazy, and who feel that just treating one patient at a time might not be my journey, but I maybe want to do so much more in a very different manner. So I think that's something which this book kind of teaches. And also when you talk about med tech innovation and how you people have written down the processes and all of that, I think in our own journey, human-centered design अलग से सीख लिया. वो ऐसा लगता है कि अच्छा कोई और आप tech product बना रहे हो तो उसमें पे तो apply करता है, but maybe if it's a health tech product, maybe it doesn't apply there. So I think when I was reading this book, I think each and every chapter, each and every word so much resonated with how we have, through experiments, stumbled upon solutions. And I think for the coming doctors, the future generation of med students, nurses, biomedical engineers, I think this is really going to be the stepping stone that takes it into a completely different dimension altogether. So thank you so much, and we are very excited to be a part of your journey. Thank you so much, Jahan, for doing such an interesting session and doing it physically after such a long time. And thank you to Seed team for really taking up this venture forward. Health tech used to be an area which was really forgotten, at least in the last 1 or 2 years. But I think now people are really understanding the importance of technology in healthcare. So thank you so much for bringing this forward.
Thank you. Thank you so much, ladies and gentlemen, for joining us. Please grab your copies and let us know how you find the book. Give us good reviews, bad reviews, honest reviews. We'll await. There's high tea outside. Please proceed.